Hey everybody, welcome back. This is Dr. Perry from the Pain Laser Center coming at you. And what we're going to go over today is one of my all-time favorite stretches, one of my active isolated stretching exercises. Lauren here, who's a patient, is going to demonstrate that for me. And we're going to show you internal hip rotation with the active isolated rope stretch. And just to review with the technique here, it's basically repetitions. You're going to do 8 to 10 repetitions. You're only going to hold the stretch for 1 to 2 seconds. You're going to exhale as you do the stretch, and you're going to assist with the rope at the end of the stretch. But you're only going to pull with about 1 to 2 pounds of additional pressure at the end of the stretch. And the reason we do this is that anytime you stretch a muscle over 2 seconds, it typically tightens up, and it actually gets a little bit worse for you when you lose flexibility. What I like about this one here is that most of the clients that I see in my office have some restriction on rotation of their hip joint here internally. They don't turn in as well, and that leads to a lot of problems with the hip and the back and the knee and everything. And this is a great way to get that stretch. So we're going to teach you how to wrap the rope and how to hold your hand about the repetitions as we go. We'll show you on the right side here. So what we're going to have Lauren do is that you can have a stretch strap here, or if you don't have that, you can use a regular rope, usually about 10-foot rope. And Lauren's going to bend her right leg up, and then she's going to wrap the rope around her ankle close to her foot, and it's going to come on the outside. She's going to hold this with just her right hand. And she's going to bring her right hand a little closer down to hold the rope, and her opposite hand is going to come over across to hold that knee stable. So what we're going to do is, you want you to think of a pole coming through the knee, down through the hip, down to the floor, and to the ceiling. So this doesn't shift or move or go back and forward, and there's a 90-degree angle here at the knee joint. And what she's going to do is she's going to actively turn and rotate her hip in as she pulls the rope at the very end, and she's going to stabilize here with the hand and give a little additional push. She's going to exhale and hold and count in her mind 1,1001, and she's going to rotate back, and then she's going to repeat that same movement 8 to 10 times. So the key to this is 1 to 2 second hold, a slight pull on the rope at the end so the rope doesn't do the movement for you, and the stabilization here of your hand. Always remember to exhale as you do the movement, inhale as you come back. And make sure you do both sides. 1 set of 10 is usually enough, and you can feel a significant difference in improvement in how your hip moves, how your knee feels, and how your back feels. Now what we're going to do here is also show you how we transition into going with a straight leg version of this. And this one here is where you would take the leg, keep the rope wrapped, and just take your leg straight up, lock your knee, keep your hand here, and then think about turning your hip and your leg inside the socket like turning a stick in the ground. So she's going to rotate in, pull that rope, and then push a little bit extra on there back, and then back to center. It's a little bit of a different variation on the angle of the hip. I want you to do both of these so you feel a really significant difference in the hip. Usually I like to do the bent one first and then move to the straight leg one. Feels good, right? Excellent. This is Dr. Perry from the Pain Laser Center coming at you. Make sure you visit my website for some additional tips. We'll see you soon on the other side.